Yesterday, I reported on the USDA cutting more than $1 billion in funding from schools and food banks. The funding had been used to buy food directly from local farms, and I have some very important updates for you.
Hi everyone, I'm Erin Martin with FreshRx Oklahoma.
And I'm Ellen Brown with Healthcare Actually and the Food is Health Revolution.
And we're here live reporting from Capitol Hill on the recent local food procurement agreement cuts that are incredibly impacting our farmers who have planted seeds whose contracts have been rescinded. And Ellen is going to share a little bit more about that with us.
So we spend $4.3 trillion annually on chronic disease. It's a goal of this new administration to reduce that, if not eliminate that. And there's also an understanding that food is related to healthcare and they are inextricably linked. In RFK's confirmation testimony, he said, American democracy is rooted in tens of thousands of independent freeholds owned by farmers. We're losing farmers today and we can't afford to lose a single farmer. I learned that human health and environmental health are intertwined and inseparable, and we will not succeed without the cooperation and partnership of agricultural producers, of farmers and ranchers across this country. But yet we cut the funding that keeps them connected.
Yeah, and cutting this funding, it directly contradicts with the Making America Healthy Again movement, and we want to make sure that these funds are reinstated, that produce prescription grant delays are reinstated in those funds, and those programs that are actually achieving these outcomes for MAHA movement are supported and upheld and used as a model to expand to this entire country.
Instead of taking food as medicine away.
Yes,
thank you so much.
Let's keep it going.
The funds were used by schools, food banks, food hubs, produce prescription programs, and food as medicine initiatives to buy food from local farmers. The USDA allocated funding from 2022 that is still being dispersed this year. I went through the USDA funding data and found that the funds were distributed directly through state agricultural departments. From the previous $275 million in funding, 56% went to buy produce, 25% to meat and poultry, 6% to dairy and milk, 4% to eggs, 3% to grains, and 2% to nuts, seeds, and legumes. The new round issued late last year and to be released in 2025 has been cut. Farmers have already started to plant crops to fulfill the 2025 LFPA contracts. Since the contracts were just cut, farmers are being left out to dry. It's important to understand that these cuts will impact both red and blue states. For example, Iowa farmers and institutions lost an estimated $11.3 million in federal funding that went to over 300 farms. Iowa started a similar state program to help schools purchase local food, but it only has $70,000 for the year. Oklahoma will still continue to provide food for kids when possible because of a similar state program with $3.2 million in funding from the state legislature. However, it will be close to impossible for Oklahoma to make up the $30 million in federal funding for local food purchasing that was cut. Regardless of your views on the past programs, we need to help schools, food banks, food as medicine initiatives, and produce prescription programs to buy food directly from local farms. So let's focus on making that happen. I've been working with schools, gardens, and seed banks for the last year and encourage you to get involved with helping your communities as well. The two ways for funds to be reintroduced would be through federal legislation and individual state programs. You can contact your U.S. and state representatives to push for legislation that would support schools and food banks buying from local farms. I included links to all these representatives on my website blog. And as always, you can use my free resources like my farm map, community garden map, and local grain map to help find local farmers and build more resilient local food systems. We are currently working towards possible solutions to help the farmers, food hubs, and produce prescription programs. To research this further, you can look on the USDA LFPA site for their data, the state executive statements, and you can also contact the state agency provided contacts for the LFPA program. You can also easily find hundreds of farms that benefited from LFPAs with a simple Google search.